Please, may I request you all to settle down. This is an important session. This is Dr. Piush Mallick Oration. Please kindly settle down, please, fast. A humble request. Okay. May I request Dr. Vineet sir to initiate the proceedings, please, for this session. Thank you, Vineet sir.
Good morning, Piush. All of you who are here, apart from the new residents, probably they do not know, but otherwise the world of anesthesia knows who is Piush Mallick. I will never use who was Piush Mallick because Piush Mallick is alive. So, first of all, I will tell you who was Piush Mallick. Piush Mallick is an anesthetist, intensive care physician, a sportsman, a good human being, a brilliant mind, brilliant spirit, and whatnot. So, first of all, I will call upon Dr. Vimohan to speak few words about Dr. Piush Mallick. Vimohan.
Yeah. I wish I was not here. Those who know me, they know that I did my diploma in anesthesia in 2009, and I met him on Facebook. And he was so fascinated to know that I am interested in critical care and working in a remote area. He inspired me. In 2011, he forced me to buy a echo machine. That time I was not knowing how to hold the probe. Every day he will send me a video and say, Mohan, ye tu seekh. So we learned some basics. Then one day I saw on Facebook Dr. Sumit Kalra's face. Sumit, where are you? Sumit Kalra's face. He went to Dubai to learn optic nerve sheath diameter measurement, and he came and he taught us. So one day I talked with Vibhu. कि विभू यार हमें भी थोड़ा उनके पास जाकर सीखना चाहिए, क्योंकि यार फेसबुक पर जो भी सिखा रहे हैं हैंड ऑन प्रैक्टिस का अपना अल्टरनेटिव है. तो बिकॉज सुमित टोल्ड अस दैट हाउ हेल्पफुल पीयूष सर वाज फॉर यू, सो वी वर आल्सो enthusiastic and we reached there. So me and Vibhu are now in Al Zora hospital. So we entered his room. There I saw Deepak Sharma lying naked. And a probe of ultrasound probe was kept next to him, and he was teaching ilioinguinal nerve block, iliohypogastric nerve block, and then followed by other nerve blocks. Then he taught us echo, how to analyze systolic function, diastolic function, how to interpret things, how to do hemodynamic monitoring, transcranial Doppler. We stayed for about 2 days, and he was like, he was trying to drench all his knowledge into us. Great souls are those who are great source of energy and inspiration. They try to make you better individual and excel in your work. He was one of them, and it is his legacy that we are trying to continue in C and D grade cities. He was also instrumental in ensuring that we come from virtual to real world, and he was one of the pioneers who ensured that we met for the first time, and we had a wonderful conference conducted by Dr. Anil Sharma sir in 2014. So I'll only say one thing, that miss you, we adore you, and you continue to inspire us through your actions and deeds. Sorry, I can't say anything more. I'm really sorry. I love you, sir. Till my death, I will remember you. Thank you.
So may I request Dr. Vineet sir to introduce the speaker for the oration, Dr. Jayashree Sood madam, please.
Good morning and pranam to Professor Jayashree ma'am. Madam needs no introduction. It is really a great pleasure and honor for us that she is here. She spared a little time yesterday also. We all know, all who knows Dr. Jayashree, they know that she is super busy and madam की energy level को compete करना at our age, even for our age, it is difficult. Madam is a chairperson and Institute of Anesthesiology and Pain and Perioperative Medicine, Joint Secretary, Board of Management and member, Board of Trustees, Sir Gangaram Hospital, New Delhi, India. It's really difficult for me to count on the achievements of the ma'am, but still I haven't given this job to enumerate few of them. The major achievements are ma'am is member of the Specialist Board of Anesthesia of National Board of Examination, founder member, trustee and CEO, Indian College of Anesthesiologists, and she is IMA Medico Healthcare Excellence Award awardee 2019 in Excellence in Anesthesia Management at Hyderabad, Atal Swasthya Bhushan Samman 2019 by Chevron Foundation for extraordinary services and dedication towards her professions at Delhi, Teacher Par Excellence Award 2020, Best Teacher Award 2018 and Best Academician Award 2011 from Sir Gangaram Hospital. DNB examiner and MD and DNA examiner in several universities, member editorial board of many national and international journals. Madam has already presented many orations. Few of them are enumerated here. Dr. Venkat Rao Oration, Tascon 2004, Bhopal, Madhya Pradesh. Professor V. Rajgopalan and Professor V. G. Appokutty Memorial Oration 2019, Chennai. Professor S. K. Shah Oration, Tascon 2006, Surat, Gujarat. Dr. G. L. Kamra Oration, North Zone, Tascon 2015, Tanda, Himachal Pradesh. Dr. V. A. Punos Oration, Tascon 2017, New Delhi. Dr. B. R. Mittal Memorial Oration, RSA CP Con 2019, Rohtak, Haryana. Dr. A. M. Deshpande Oration, ProAct Pune Con 2019 at Pune. Dr. B. V. R. Shastri Oration, ICA Con 2019 at New Delhi. Trancrit 2019 Oration, Trancrit 2019 at New Delhi. Dr. Deepak Malviya Oration, ISA Con 2021, Lucknow. Madam has 141 publication in the journal, 30 chapters in the books, editor books of Anesthesia in Laparoscopic Surgery Volume 1 and 2, Anesthesia for Transplant Surgery, Clinical Thoracic Anesthesia, COVID-19 Pandemic and the Anesthesiologist. She is author of Atlas Procedures in Neonate and Pediatric Practice. Areas of interest are anesthesia for transplant, thoracic, laparoscopic surgery and pain management. And one more, the more important is feeding the juniors with her enormous knowledge and love. With my folded hand, I request ma'am to please come and join.
May I have a shawl presentation to ma'am by Dr. Meera Kharbanda, please? Yeah. May I request Dr. Purnima Dhar to present the oration plaque to ma'am, please? Thank you. Thank you. Today's topic for the oration by ma'am is Achieving Supereminence, the Way Forward. Thank you, ma'am.
Good morning, everybody. Thank you for those kind words of introduction. And what we've heard about Dr. Mallick, Piush Mallick, has moved me so much that I don't know whether I'll be able to present the oration the way I wanted to. A lot has been spoken about him. I didn't have the opportunity to meet him, but what I have heard about him and what I've known about him is that he belonged to Cuttack, Odisha. He did his undergraduation over there, MD from All India Institute, New Delhi in 2004, and then he went to Dubai, Sharjah Hospital, where he was vice chairman of the Department of Anesthesia. Unfortunately, we lost him at a very young age of 2018, in 2018. He was a very dynamic personality, as we just heard, and he has mentored so many of you. And today is a day when I'm going to be speaking on the oration on his name, and I am truly honored and humbled. I would like to thank the organizers of the Tascon 2022 and Dr. Anil, who invited me for it. It's indeed an honor. I'm humbled, and truly it's a very big day for me, and all the honor that I have received today and yesterday. Keeping in sync with the dynamic personality of Dr. Piush Mallick, I have titled my oration as Achieving Supereminence, the Way Forward. I bring greetings from the Sir Gangaram Hospital, which is a 675-bedded super specialty hospital situated in the heart of New Delhi. And those who have not visited and have come from outside Delhi, it would be a pleasure to host you all one of these days while you are still here. So what is supereminence? The Webster's Dictionary, they define supereminence something of superior eminence or rank or dignity, a distinguished or a prominent person who is conspicuous and worthy of note above others. But let me tell you what is supereminence. Eminence does not stop there. You have to do something more. Usually the eminent person is somebody in his profession. But supereminence means you have to go beyond your profession, do something which really makes you supereminent. As was said by our late President Abdul Kalam, to succeed in your mission, you must have a single-minded devotion to your goal. And so also, the President Theodore Roosevelt said many years ago, the more you know about the past, the better you are prepared for the future. So I see many students in the audience here, and for them I want to say that the past should always be known before we pursue our path to become an anesthesiologist. So this was the state of affairs, how surgery was done in the early 19th century. As you can see here, he is the very famous surgeon of that time, Liston, and he was famous for amputating the limbs within 2 minutes. And look how he's being held by the onlookers. and they're holding him tight so that the amputation is done as fast as possible. And you know that the historic demonstration of anesthesia actually took place on the 16th of October in 1846 in the Ether Dome at Boston, Massachusetts. And this was the time when the surgeon Warren actually said, "Gentlemen, this is no humbug." This he was referring to the ether that Morton had demonstrated on the patient, and Morton at that time was only a medical student. So see the students how the history has gone? And this is what we used in the mid-70s. Some of my colleagues have used these anesthesia machines, the Boyle's machine which we used in the 70s with these Boyles, with these glass bottles as vaporizers, which you just see for exam purposes these days. And what you are lucky now to see, that you have these workstations and all monitoring devices, and you name it and you have it. You have the robotic surgery, and because of that, the robotic anesthesia has also advanced so much. If you see the scope of anesthesiology, if you just try and analyze it, you could either have an expansion in the horizontal way or in the vertical way. You could compare the scope of anesthesiology as the Nile River, which passes through so many countries, and the scope is highly visible. It is taken over by so many countries, so many political aspects to it. In the same way, if you have a horizontal scope of anesthesiology, where the subspecialties started from either end, the roots were really not connected to the center. So possibly an expanding scope, a vertical way would be maybe better, in which the scope in the vertical is like the Eiffel Tower, which stands upright and strong, and where is you can see, appreciate there, the base is our basis, and then the underground is what is we must always know is the physiology and the cellular activity for the base of our understanding of anesthesia. And after that is how you go above, and you can have the various surgeries, the surgical specialties, and the advances that take place. But you are sternly very bound to the roots. We've been taking care of the intensive care unit for years together. So also we have been in charge of the pain, acute and chronic pain. We are the leaders over here. And so also in trauma and the disaster team, we are either the team leaders or the team members. So the anesthesiologist, anesthetist of yesteryears, whom nobody knew, they just said the gas man behind the ether screen. Nobody even knew the name of that person, was just behind the mask all the time, gradually changed into an anesthesiologist, where people or the doctors or the fraternity started appreciating who that person was and how important it was. And this is the latest, where we are known as perioperative physicians. We carry a lot of importance in the fraternity. There are so many decisions which are not taken without us. So as Peter Rock said, anesthesiology is perioperative medicine, because we take care of the patients right from the decision to operate till the discharge after surgery. So truly a perioperative physician. So also perioperative surgical home. This is the concept which is being discussed in the last few years in the United States of America, and where they say that the continuation of the patient care should not stop just after discharge, but after about a month after discharge also, for continuity of care, and it is the anesthesiologist who has been made responsible. So perioperative surgical home as well is under the care of the anesthesiologist, so it provides better health care and a better patient experience. So what is healthcare? Healthcare is the organized provision of medical care to individuals and the community, and anesthesia is no more limited to the OT, and it is now contributing to the full healthcare expanse of the cities. Now this is very interesting. If you see here, right from the preoperative period, after surgery is decided, of course that's the only decision the surgeon takes, but later on the patient preparation, the surgery, where intraoperative we are truly the physicians taking care of the black box, and then the post-operative period is completely looked after by us. So who is responsible for the health care of the community? Is it the anesthesiologist or is it the surgeon? The answer is very clear. As rightly said, so how do we perform these multifaceted roles as an anesthesiologist? Often preached by Francis of Assisi. He said, start by doing what's necessary, then do what's possible, and suddenly you're doing the impossible. The key to success is patience, persistence, discipline, and faith. And as Abraham Lincoln said, I will prepare, and someday my chance will come. What about anesthesia now going into the future? Now we know there is anesthesia avionics, artificial intelligence coming in a big way, medical virtualism, and digital health. Digital health is the in thing these days. And this is nothing else but the electronic health, where there's the application of information and communication technologies for the management and optimization of patient care services. And WHO defines the field of knowledge and practice. It as the field of knowledge and practice associated with the development and use of digital technologies to improve health. This digital health in our country also is being now coming into practice in a big way, and we anesthesiologists will be responsible to improve the patient care in the periphery. Here we have the calculation-based apps in which we can convert opioid dose, infusion dose, corticosteroid dose, anything with the use of these apps. Simulation in anesthesiology is now, it's not something in the future or something that to be thought about, it's definitely there, and that will go a long way in helping the students learning what's very, very essential. So if you see, anesthesia can be compared to a telescope where you can actually experience and you can realize how we started in the 1850s. Then we went on into the 1900s, started with the pharmacology, then the technology came, and slowly the monitoring came, and ultimately the scope, there is no end to it. NASA chief has said that if human species has to survive this century, then they must look forwards to ways to inhabit the moon and the Mars by 2030. So imagine anesthesia will also be practiced in the extraterrestrial space. So as John Wooden said, big things are accomplished only through the perfection of minor details. So this is the pyramid of success. You start with the basic, have a strong theoretical knowledge, then you go on to your practice, and then the desire to improve, and ultimately you reach the peak, which is quality outcome. So what is anesthesiology now? It is not just remained a medical specialty that is dedicated only to clinical services, but it proffers a full expanse of healthcare that covers the patients before, inside OR, and long thereafter with an outreach extended care. So we are at the crossroads. We are practicing anesthesia. We are becoming very good clinical anesthesiologists. Now how do we become more eminent in our personality? You can choose any of the paths, and while you're practicing, and if you choose the path of excellence, naturally education and teaching plays a very important role. So success isn't always about greatness, it's about consistency. Consistent, hard work gains success, and greatness will come. So while you're studying and teaching the students, it's very important for the students to understand there is something known as tacit knowledge. And what is this tacit knowledge in anesthesiology? It is the knowledge that your teachers have gained through living experience, both in personal and professional development. So these are that knowledge which is often subjective and difficult to express. And probably this represents a higher level of knowledge. So the students must realize that it is not only explicit knowledge that is important to be learned from the seniors, but also the tacit knowledge that they have. Besides the clinical skills, non-technical skills are playing a very, very important role in the management not only of the students' education, but in general in our lives. So all these terms are very important. Task management, team working, situation awareness, decision making, and time management. All are important, and the last one which I would like to stress upon is the time management, which the youngsters should understand, and we as seniors should teach them how to manage time with all these multitasking that they have to do even at home, but that is very, very essential. So how do you define excellence in anesthesia as teachers? Besides clinical skills, you must have an interest in teaching, innovations, communication skills, which are also very important in the non-technical skills. Communication skills carry a major role in this. Personal qualities of a person and good relationship, not only with patients, but among our colleagues as well. So remember, in pursuit of excellence for anesthesia education, the educators need to go beyond the usual see one, do one, teach one motto. They must remember that they have to change their strategies, learn new things, so that not only should they pursue an excellent teaching, but also engage in scholarly teaching. And no single model or the best practice exists in teaching. Now, if you see here, this is very interesting. You have a teacher, a learner, and an assessment being done, which can be actually thought of as the continuum of education, and all in the purview of the context. So wherever they converge, the teacher, the learner, and the assessment is where learning comes. So it's important when you're doing all these three things that convergence and learning is successful. So what are the characteristics of a good teacher? See our late president, where he's sitting and where the journalists are sitting. He was so humble, and that is one thing that we all have to learn to achieve this kind of a status. Friendliness, supportiveness, and so down to earth. So we should not be only a good clinician, but also a good teacher, so that we also become role models. But when we become role models, we should ensure that it is all done in a very humane way. Here, what about the future needs and directions of the specialty, which are so essential? Here the teachers have to remember that they must also learn. It's not that they shouldn't have the fixed mindsets that nothing can be changed. They have to do a lot of reading themselves to ensure that they can teach the latest to the students. And this is what has been done, the virtual teaching. The teachers who did not stop at the time of the COVID, if you remember, and this is the Indian College of Anesthesiologists, which is running weekly webinars since the last, this is the 100th webinar that we'll be celebrating on the 15th of June. So without any break, the teachers have excelled, and they have all contributed to the virtual teaching. So seeing all this, mentoring as a mentor is important. Not only do you train, you motivate, you give advice, of course, give them a direction, coaching, support, goal, so that ultimately they are successful. So while we have mentored, what do? Yes, we do our clinical skills, we go and teach our students, but it's very important that we have to remember that we have to empower the future generation. As we look ahead into the next century, leaders will be those who empower others. So this is the time we have to learn that this has to go on. Leadership, focusing on a goal and inviting everyone to help achieve it. Because although the leader may be the leader, but he has to take everybody along, and only then it becomes. Leader does not have this leadership, does not have any hierarchy. All are equal, all can give suggestions, and that is what is leadership. So the clinicians, the anesthesiologists have reached the OT, of course, pain relief, ambulatory center, the hospital. They have now administrators. They have reached that state where they are administrators, and there are many areas where you will see that the anesthesiologists have reached very important administrative roles in different parts of the country. And this, you remember, we can never forget the role of the anesthesiologist during the COVID times, where everybody backed out, and we were the only ones. And this was the first time that in the Time magazine, the role of the anesthesiologist in the COVID was also presented. So together, we achieve more. And as depicted here, teamwork is the secret that makes common people achieve uncommon results. Ambition is the path to success. Persistence is the vehicle you arrive in. So what is the future? Anesthesiology 2030. Everybody talks about the future. And in this, they are trying to say that you have to maintain a balance not only between the individual rights of the patient and the anesthesiologist, but also society obligations, meaning thereby don't stop at your own hospital or at your own place of work and with your students. Go beyond that. Give high quality anesthesia, ensure that all patients, all people, all over in the periphery receive it. And this is what we have done in our hospital. This is the Parvati Hospital in Himachal, where we have an outreach program, and all the patients over there are managed by consultants of the Sir Gangaram Hospital. Faith can move the mountains. Remember, teamwork begins by building trust, and the only way to do that is to overcome our need for invincibility. At the individual level, be patient, persistence, have discipline and faith. Be a mentor, teaching skills with a long-term vision. Have belief in teamwork. Team has to be consistent, and they should also believe in hard work. Henry Ford said, failure is simply the opportunity to begin again, this time more intelligently. There is no disgrace in honest failure. There is disgrace in fearing to fail. So I'd like to conclude that just the way the true spirit of Christmas lies in our hearts, the same way the spirit and the memory of Dr. Piush will stay in our hearts. Thank you.
Thank you very much, ma'am. It was a wonderful memory, beautiful insights, way forward, future, past. The beautiful picture was Eiffel Tower with the height of the tower and the base. I saw the base was even bigger than the height of the Eiffel Tower. So to be a good anesthetist, anesthesiologist, whatever you say, as madam says, the baseline should be even bigger than what you have been seen as an anesthesiologist, like physiology, anatomy, biochemistry, instruments, team building. There are few more qualities a person need. To be a good doctor, you need to have the good knowledge, skills, and apart from that, behavior and competence. Thank you very much, madam. We are really honored to you have here. Thank you. May I call upon Dr. Hetal to start the next session. We will be having a little change. Hetal will announce it.